Millions of people of reproductive age are affected by infertility, and their families and communities are affected as well. Infertility affects 48 million couples and 186 million people worldwide, according to estimates. Infertility in women can be caused by a number of factors, including issues with the ovaries, uterus, fallopian tubes, and endocrine system. If you haven't been able to conceive in an acceptable amount of time, consult your doctor for an infertility evaluation and therapy. Your partner and you should be assessed. Your doctor will review your medical history and perform a physical examination. Your doctor may ask you to keep track of ovulation symptoms like basal body temperature and cervical mucus. So, don't forget to hit the subscribe button. Subscribe to this channel, like the video, comment, and share the video. Thank you. So, how do we diagnose female infertility? The following diagnostic test can aid in the diagnosis or exclusion of a female reproductive issue. Pelvic exam. A pelvic exam will be performed, including a pap smear, to screen for structural issues or symptoms of disease. You will strip from the waist down and lie down on a padded table in your doctor's office for a pelvic exam. Your doctor will take a seat close to your feet. He or she will use a speculum to insert inside your vaginal canal. This allows your doctor view within your vaginal opening. Two lubricated gloved fingers will be inserted into your vagina by your doctor. He or she will gently push on the exterior of your lower abdomen with their other hand. This is how your doctor will examine your uterus and ovaries for size and form, soreness, and strain growth. Ovulation testing. The rise in luteinizing hormone that happens before ovulation is detected by an at-home over-the-counter ovulation prediction test. Ovulation can also be confirmed by a blood test for progesterone, a hormone released after ovulation. Other hormone levels, such as prolactin, may be tested as well. Transvaginal ultrasound. An ultrasound wand is inserted into the vagina to check for abnormalities with the reproductive system. Your fertility care team can see your reproductive organs, including your uterus and ovaries, via a transvaginal ultrasound. Because a transvaginal ultrasound can be used for a variety of purposes, your aim will be determined by the type of ultrasound you use. When you are a new patient, your doctor will perform a transvaginal gynecological ultrasound while you are on your period to check for fibroids, polyps, or uterine lining anomalies. Your doctor will also measure the volume of your ovaries and count the antral follicles, which will provide us information about your egg reserve. Your doctor will also examine your ovaries for cysts or tumors. Hysteroscopy. A narrow lighted tube, that's a hysteroscope, is used to inspect the cervix and the inside of a woman's uterus to look for issues. The size, shape, and lining of the uterus, as well as any related anomalies that may influence female fertility, are revealed during hysteroscopy. A hysteroscope is introduced into the vagina and carefully advanced through the cervix into the uterus, where a liquid solution or carbon dioxide is delivered through the hysteroscope. to expand the uterus while the patient is under anesthesia. A light and camera on the hysteroscope allow the doctor to observe the endometrium, that is the uterine lining, ovaries, and fallopian tubes on a video screen once the uterus has been enlarged. Saline sonohysterogram. A diagnostic ultrasound called a saline sonohysterogram is used to detect any abnormal formations on the inside of your uterus. It can provide information about fallopian tube obstructions. SIS, that's saline sonohysterogram, is another name for this process, which is saline infusion sonography. A catheter is used to inject a little volume of sterile saline solution via the cervix into your uterine cavity by an ultrasonographer. Your cavity then swells, allowing abnormal structures such as fibroids or polyps, which may interfere with pregnancy or cause irregular bleeding, to be seen. Your fallopian tubes may also show signs of a saline solution spill. As a result, they are open and unhindered. Hysterosalpingogram. X-ray contrast is injected into your uterus during hysterosalpingography, and an X-ray is obtained to check for issues inside the uterus. The test also determines whether the fluid leaks from your uterus and into your fallopian tubes. If any issues are discovered, you will almost certainly require additional testing. This test looks for any obstructions. Laparoscopy. Making a small incision behind your navel and inserting a thin viewing equipment to examine your fallopian tubes, ovaries, and uterus is all part of this minimally invasive procedure. Endometriosis, scarring, blockages or abnormalities of the fallopian tubes, and problems with the ovaries and uterus can all be detected with a laparoscopy. Ovarian reserve testing. This test determines the quality and number of accessible eggs for ovulation. This series of blood and imaging tests may be given to women over 35 who are at risk of having their egg supply decreased. Measuring hormone blood levels is a typical approach to check ovarian reserve. At the start of the menstrual cycle, the hormone follicle stimulating hormone and estradiol are measured. This is normally done on day 3 of the cycle. However, it can be done any day from 1 to 5. These hormone levels can reveal crucial details about how the ovaries and pituitary gland interact. Genetic testing. Genetic testing can be done to see if you have a genetic mutation that is affecting your fertility. There are 2 forms of genetic testing offered to women who are trying to conceive. The first one is genetic carrier screening. By evaluating their DNA to check if they are a carrier for a number of genetic disorders, this test can identify individuals and couples at risk of having a child with a genetic issue. Carriers of a hereditary disorder are unlikely to develop the disease, but they may pass it on to their children. The gene for Fragile X syndrome is included in several carrier screening panels. Women who carry the Fragile X gene are more likely to develop primary ovarian insufficiency, which happens when the ovaries stop working properly before they reach the age of 40. Now, another test is a karyotype. This is a blood test that examines one's chromosomal